Acupuncture. Finding the right acupuncture treatment with the best benefits. Written by Quinn Spencer. Narrated by Eric Boozer. What are acupuncture points? What are acupuncture points? Do they have something to do with nerves? In fact, acupuncture points really don't have much to do with nerves at all. What they are, and how they are able to affect all sorts of aspects of health, is a bit of mind-bending trip. Are you ready to take the red pill? Much more than pain management. If you look around in the media, you'll eventually come across someone explaining that acupuncture is simply a manipulation of nerves that results in the body releasing endorphins. Endorphins are the feel-good chemicals of the brain. The endorphins, the hypothesis goes, and then act to mediate the experience of pain in the body. It's a tidy, straightforward answer that's easy for most people to accept. It is also obviously woefully incomplete. The problem with this hypothesis is that pain is just one thing acupuncture can be used to treat. Endorphins can't explain how acupuncture can be used to regulate menstrual cycles, enhance fertility, help insomnia, open congested sinuses, treat digestive issues, help people quit smoking, and so on. Obviously, there has to be more to acupuncture than the release of endorphins. Caves. The word for acupuncture point in Chinese is shui. The top point of the character for this word is said to represent a covering while the bottom part represents a hole. The word is also translated as cave, so the word point is missing some of the connotations of the original Chinese word. An acupuncture point is a three-dimensional thing. It is a cave. It provides an access to something deep. What lies beneath the surface is acupuncture channels. Acupuncture channels, sometimes called meridians, are a topic in and of themselves, but are beyond the scope of this article. That said, it is sufficient to understand that acupuncture points provide a deep access to the energy of the body. Field effects. Through the last century or so, the science of physics has begun to illuminate some of the strange rules by which the universe works. Energy and matter were discovered to be interchangeable. We begin to see that matter exists as a wave or a field of infinite size. Originally, it was thought that quantum mechanics only applied to the very microscopic world of atomic particles. Recently, research published in the scientific journal Nature has shown that quantum effects can be observed in things big enough to see with the naked eye. The foundation of modern science is Greek philosophy. The foundation for the science of acupuncture is Chinese Taoist philosophy. More and more, these two sciences describe the universe in similar terms. I see this as an indication of progress, as they both attempt to describe the universe as it actually exists. Acupuncture works on the biological field of the body, like a pebble dropped into a still pond. Needles inserted into acupuncture points send ripples out as they enter and interact with the energy field of the body. Each point has one or more specific effects on some aspect of the body. Some act primarily in the area of the body near to the point. Others can have effects on the far side of the body. Still others have a systematic effect on the body. Using the science of Chinese medicine, an acupuncturist knows which points to select to achieve a particular effect on the body that will bring it back to a state of health. Discovered, not created. As human beings, acupuncture points are a part of our energetic anatomy. They have always been there. Through careful observation and experimentation, over thousands of years, the acupuncture points were slowly discovered. Taoist philosophy allowed the ancient Chinese to develop an understanding of the laws of nature and the cosmos. It was through this understanding of the rules of the universe that the system of acupuncture was able to be discovered and decoded. You may be interested in more concrete details about how acupuncture is used in specific health conditions. For instance, you can read about acupuncture for menstrual cycle regulation as well as acupuncture for sleep disorders. What is medical acupuncture? Acupuncture is a very old Chinese medical art. It is a technique of inserting and manipulating fine needles into specific points on the body with the aim of relieving pain and for therapeutic purpose. There are many approaches to learning and practicing it. Medical acupuncture is the term used to describe acupuncture performed by a doctor trained and licensed in Western medicine that has also had thorough training in acupuncture as a specialty practice. Such a doctor or health professional may use one or the other approach, or a combination of both, to treat a dysfunction or illness. How medical acupuncture evolved. Study of traditional Chinese medicine takes a lot of time. That is the reason medical acupuncture was created for Western practitioners who wants to use the techniques of acupuncture along with other medical approach. Medical acupuncture was created for medical doctors, physiotherapists, chiropractors, and osteopaths. The person who learns about acupuncture is known as acupuncturists. The term alternative medicine is usually used in the modern Western world, encompasses any healing practice that does not fall within the realm of conventional medicine. Acupuncture is considered to be one of such alternative medical techniques. Medical acupuncture is an attempt by evidence-based medicine to understand the effects of acupuncture from a Western, scientific perspective, rather than within the paradigm of Chinese traditional medicine. How medical acupuncture is different from classical acupuncture. Medical acupuncture is a contemporary form of acupuncture that was developed by medical doctors in the Western world. In medical acupuncture, the traditional theory of points and meridians is either ignored altogether or is radically reinterpreted because there is supposedly no physical verifiable anatomical or histological basis for the existence of acupuncture points or meridians. Also, in case of medical acupuncture, the concept of disease are derived from modern Western pathology instead of Chinese medical theory, which predates use of the scientific method. Lastly, the medical acupuncture is understood to work via the Western biomedical understanding. World Health Organization, WHO, recommendation. Following are the conditions for which acupuncture is recommended by WHO. Respiratory diseases such as acute sinusitis, acute rhinitis, common cold, acute tonsillitis. Bronchopulmonary disease such as acute bronchitis, bronchial asthma. Eye disorders such as acute conjunctivitis, cataract without complications, myopia, central retinitis. Disorders of the mouth cavity such as toothache, pain after tooth extraction, gingivitis, pharyngitis. Orthopedic disorders such as periarthritis, humeroscapularis, tennis elbow, sciatica, low back pain, rheumatoid arthritis. Gastrointestinal disorders such as spasm of the esophagus and cardia, hiccups, gastrophosis, acute and chronic gastritis, gastric hyperacidity, chronic duodenal ulcer, acute and chronic colitis, acute bacterial dysentery, diarrhea, paralytic ileus. Neurological disorders such as headache, migraine, trigeminal neuralgia, facial paralysis, paralysis after apocalyptic fit, peripheral neuropathy, paralysis caused by poliomyelitis, Meniere's syndrome, neurogenic bladder dysfunction, nocturnal enuresis, intercostal neuralgia. Modern explanation. There are two attempts at Western medical explanation about the mechanism of acupuncture. The gate theory of pain by Patrick Wall and Robert Malzak, which postulates the existence of gates or filters in the spinal cord that can modulate transmission of pain information within the nervous system. The second explanation is based on the existence of natural opiates in the central nervous system and elsewhere in the body. It is the pain-relieving substances such as endorphins and encephalin. Acupuncture for a healthy life. Acupuncture has its origin from China. It involves the insertions of thin needles into certain locations of the human body. These locations are generally termed as acupuncture points and form the main focus of the acupuncture treatment. The procedure may also involve the application of pressure, heat, or laser light at the acupuncture points. The way of practices varies from country to country, while the underlying principle remains the same. According to the theory of acupuncture, there are certain patterns of energy flow in the body, and these energy flows are important for health. The disease causes the disruption of the energy flows, and the acupuncture involves in correcting the imbalanced flow of the energy at the identifiable points. Healing power of acupuncture. In the recent times, acupuncture has been grabbing attention from many people around the world. The non-invasive nature of the treatment with fewer side effects has attributed to its popularity. The treatment not only eases the symptoms, but also works on the root cause of a problem associated with a disease. The patients who undergo the acupuncture feel a sense of satisfaction and relief. The various ailments like nausea, vomiting have been cured by the teaching of acupuncture. They are widely practiced as the therapeutic interventions across the U.S. The dental pains associated with the post-operations are cured with the adaptation of acupuncture treatments for many people. Some of the situations like addiction, headache, low back pain, stroke rehabilitation, asthma are also addressed by the acupuncture and are shown to produce positive results for many people. Some of the amazing benefits of acupuncture include the following. 1. It helps in reducing the number of migraines per month with the electroacupuncture. 2. It cures the seasonal allergies. 3. It improves the mood by regulating the neurotransmitters in the brain. 4. It can enhance the activities of immune cells. 5. It helps in reducing the weight to cure obesity. 6. It helps in maintaining a balance in body temperature. 7. It cures the sleeping problems and cures insomnia. 8. The regular seasons of acupuncture can reduce the stress level and blood pressure, thereby keeping the heart healthy. 9. It can address issues related to the lower back discomfort. Possible side effects. The needles used in the treatment process of acupuncture are shown to produce accidental punctures in the lungs. This could be serious because it causes partial collapse of the lungs. The infectious side effects include hepatitis and some bacterial infections in the sites of needle insertion. These side effects can be eliminated if the person doing the acupuncture takes proper precautionary steps. Acupuncture myths. Even though the practice of acupuncture has been around for thousands of years, it is still the subject of many myths. Acupuncture is one of the fastest growing fields of alternative medicine and is even covered by many health insurance and state workers' compensation plans. Here are 8 of the biggest myths. No scientific basis. Acupuncture may be a form of alternative medicine, but peer-reviewed studies have found that acupuncture treatments do correlate to a reduction in the patient's perceived levels of pain. Needles not safe. This myth relates to the mistaken belief that the needles used in acupuncture treatments can carry disease or are unsanitary. Acupuncture needles come in sterilized, sealed packages. The needles are only used once. After use and treatment, the needles are treated as medical waste and properly disposed of. You have as much to fear from a dirty needle at the acupuncturist as you do at the doctor for the needle used in a shot. Acupuncture treatments are required daily to work. Acupuncture is painful. Typically, acupuncture is nearly painless. Some patients report feeling a slight pinch, less than typical with a shot at the doctor, with the application of the acupuncture needle. Acupuncture works, in part, to relax the body and restore balance. Causing pain is not an effective method for acupuncture treatment. Acupuncture and traditional Chinese medicine are the same. Acupuncture uses the principles and understanding of traditional Chinese medicine. However, it is its own independent field of study. Traditional Chinese medicine also relies on herbal remedies, Tai Chi. Acupuncture sessions last a long time. A typical acupuncture session lasts 30 minutes to 1 hour. This includes the pre-acupuncture examination and the time it takes to make a diagnosis and formulate a treatment plan. Acupuncture needs to be done every day to work. Every patient is different. However, most patients do not need daily treatment. Most patients need to receive a series of acupuncture therapies, but the sessions are typically once a week to once a month. Patients that need daily sessions are rare, and typically the daily sessions are only for a brief period of time until the acute problem is brought under control. The needles are long. Acupuncture needles come in a variety of sizes. Most acupuncture needles are less than a half an inch in length. A typical hypodermic needle is about the same length as an acupuncture needle, but it's also much thicker. Anyone can be an acupuncturist. The vast majority of states require a rigorous licensing procedure for acupuncturists. A certified acupuncturist must complete 4 years of coursework with a clinical internship of over 1,000 hours. Additionally, before receiving an acupuncturist license, applicants must pass an examination. Many acupuncturists also first obtain a university degree. Once licensed, in order to maintain their license in good standing, acupuncturists have to attend regular continuing education classes and follow the safety and ethical standards of their profession. Acupuncturists are part of the healthcare community. Acupuncture nutrition. Know the right acupuncture diet for your treatment. Now that you have started using acupuncture as an alternative cure to your health problems, it is very imperative that you support your recovery with a well-balanced acupuncture diet. You must also know that taking the right diet is what makes your treatment successful. Therefore, you must know what types of diet to adopt if you want acupuncture to work for you. Before you actually choose an acupuncture diet to supplement your treatment, it is advisable for you to see your doctor. Your acupuncturist will tell you the diets you should take after your treatment. Be warned that choosing a professional and qualified acupuncturist is what you need to know the right foods to take. So if you want to adjust to your new diet, make sure your doctor is aware. Today, herbal diets have proved to be very effective in healing with health issues. Some acupuncturists will advise you to take herbs or natural tea made from herbs. In addition, they may ask you to take herbal pills or supplements before starting an acupuncture treatment. Whatever recommendations your doctor will give, be sure to alert him or her of your allergies to certain foods or herbs. Doing this will help your acupuncturist provide you the best and appropriate diet for your acupuncture treatment. When you take the correct diet, the food helps to produce important nutrients that can be very useful in acupuncture. These nutrients make your body defense system to be stronger and fight whatever is the cause of that ailment in your body. This further makes acupuncture to be more effective in your body by removing all the pains faster. This process also makes more energy for acupuncture to reach out to the affected areas in your body. Therefore, taking the right acupuncture diet is one of the best ways you can make acupuncture treatment work for you. This is why you must know what to eat to complement the effort of your acupuncturist on your health. You need the right diet for your acupuncturist now if you must stay healthy at all times. So, locate a professional acupuncturist to give you all the necessary information on the right diet for your treatment. You can find out the right food from your acupuncture from the internet. Acupuncture safety and risks. To many of the Chinese practitioners of acupuncture, who are highly trained and committed to aiding a whole range of ailments with their skills, it must seem peculiar that outside of China, acupuncture safety and risks would be an issue. Acupuncture has been practiced for more than 2,000 years in China, and yet, strange as it may seem, it has only in the last 20 years become well known outside the East. Acupuncture safety and risks are still an issue, though, because acupuncture remains a method of treatment which is considered unproven by the medical profession. The current official view is that the jury is still out on whether acupuncture really does work. This is the case although a large number of reports on it, both in U.S. and elsewhere, has been completed. Studies have included large studies on the technique carried out in China, but despite that the medical profession still considers the jury to be out on whether acupuncture has significant beneficial effects. If it was clear that there were big benefits, as may yet still be demonstrated, acupuncture safety and risk would be balanced against the obvious improvements provided. If the benefits were scientifically proven to be large, it would be an easy matter to show that it was worthwhile for people to take the treatment, even acknowledging some acupuncture risks exist. The point being made by some top authorities on alternative medicines is that until the ability of acupuncture is clinically proven to reduce pain, virtually any risk from the procedure is too much risk, and hence the procedure becomes inadvisable as a matter of principle. This is a very tough test to apply, and one would ask whether, if a patient was able to avoid taking prescription pain relievers such as aspirin, paracetamol, and codeine after acupuncture, that would not in itself justify the treatment. Even these drugs, which we take without further thought, do come with risks to our health, albeit at a very low level. No medical experts appear to be suggesting that the risk of a negative experience with acupuncture is anything other than very low when the procedures are carried out by well-trained practitioners. In fact, across a number of studies now completed with large numbers of people in the study groups, acupuncture safety is not really a concern in the vast majority of cases, and therefore risks appear to be very low. A few deaths have occurred with a large sample in a Chinese study, but information is reported as being scanty on the circumstances of death, and many people may conclude that the very small percentage of deaths could easily be accounted for without attributing significant risk to the treatment. The various other studies show that when practiced by highly trained experts in acupuncture, the main risks appear to be about hygiene and the sterilization of the needles used. Medical errors may occur when needling too deeply or in the wrong angling of needling insertion. Some problem cases have been identified with needling for back pain alleviation if the needle is not placed correctly. Sometimes there have been practitioner error and/or negligence, but that happens in all walks of life at a very low frequency, and acupuncture is unlikely to be any different. For individuals considering acupuncture treatment, we suggest that you bear in mind the current medical profession's official view that the technique is unproven for reduction of pain until studies show otherwise. It is also possible that if you do not obtain medical advice on your complaint before obtaining acupuncture treatment, an underlying cause may not be diagnosed, so always get medical advice first. The decision must be yours, and the risk which you decide is worthwhile should be balanced by the benefits which you perceive you will receive from the treatment. You need to weigh up the balance of benefit against risk for yourself. It is your decision. Alternative medicine, acupuncture therapy basics. The latest research found shows that acupuncture treatments are more successful in treating countless medical conditions. The cost of acupuncture treatments can cost hundreds of dollars to as much as thousands of dollars, which really depends on the quality of treatments and the length of acupuncture treatments needed. In addition, there are a lot of acupuncture procedures that goes further into inserting a needle. More research has documented findings that it is not completely known how acupuncture methods work entirely. However, there are some points that acupuncture improves the production of endorphins that makes the entire body feel completely relaxed and helps reduce stress. Acupuncture treatments have documented to be great success in treating injuries related to tense, scared, or irritated tendons, nervous tension, or muscles. It has also been found that people do not know that acupuncture procedures are good treatments for depression, allergies, stress, anxiety, insomnia, and sinusitis. It is found that lately more people are looking into acupuncture therapy for weight loss. Some evidence shows that acupuncture procedures are very effective than inactive medications for relieving post-treatment pain and is maintained at follow-up. Acupuncture treatments take approximately 25 minutes, but again, the acupuncture therapy can vary depending on the patient's condition. Most acupuncture treatments can also be provided simultaneously with other medical treatments, such as traditional Western medicine, chiropractic adjustments, and/or naturopathic prescriptions. However, it is quite general with the first couple of acupuncture treatments to have some sensation of great relaxation and also some mild incomprehension directly following the treatment. Acupuncture therapy involves a sequence of weekly or bi-weekly treatments in an outpatient setting. It appears that acupuncture treatment is very useful as an individual treatment for several health conditions, but acupuncture also even more used in combination with other traditional Western medical treatments. Many studies have found that acupuncture treatment can reduce the number of Raynaud's phenomena, helps improve conditions such as irritable bowel syndrome, along with enhance other medical treatments for gout if used with combined therapy. There is an overwhelming majority of patients who find that acupuncture treatments are quite comfortable and exceptionally relaxing. Most patients actually fall asleep throughout treatment, even though it is a quick procedure. An acupuncture method applies heat, needles, pressure, and other acupuncture treatments to numerous locations on the skin called acupuncture points. Before beginning acupuncture therapy, ask the acupuncturist chosen about the quality of treatments suggested and an estimated cost of the treatments. Acupuncture treatments are becoming more accepted by the public and by physicians. Most acupuncture therapy is also practiced by a number of certified medical practitioners that belong to some professional acupuncture organizations that publish semi-annual journals. The acupuncture procedures have been effective in a variety of areas in the healthcare field. In further research, studies on acupuncture treatment will not be only major for the health and welfare of the patients, but also important for the advancement of medical science. Considerable controversy has encircled acupuncture. On the one hand, huge claims have been made for its efficiency. On the other hand, acupuncture has been critiqued for its absence of scientific standing. Benefits of acupuncture treatment. Acupuncture is a form of traditional Chinese medicine that employs the use of special hair-thin needles that are inserted just below the skin at strategic points in the body, known as acupuncture points. This helps in regulating the flow of energy, stimulates the body's healing mechanisms, mitigates pain, and restores good health in myriad ways. Acupuncture increases fertility. Women getting IVF treatment can increase their chances of getting pregnant by 50% if they get the right acupuncture treatment. Acupuncture reduces your number of headaches. Instead of stocking up on aspirin, acupuncture can be a very effective tool in struggling with the frequent and severity of headaches. In many patients, acupuncture can extinguish headaches altogether. Acupuncture helps patients fight depression. Many patients suffering from depression, whether mild or severe, are undergoing acupuncture as an adjustment treatment for their condition in recent years. Acupuncture helps with weight loss. Acupuncture can bolster a patient's resilience, help fight cravings, and enhance a patient's ability to respond positively to healthy diet and exercise choices. Benefits of acupressure and acupuncture in asthma sufferers. Needle acupuncture has shown symptomatic relief to individuals with asthma in several studies. As an alternative method of stimulating acupuncture points, acupressure may also have the potential to provide similar benefits to asthma sufferers. Stress management. Acupuncture has been a proven modality for stress relief, and as we reduce our stress level, many other health problems will disappear. That is because an acupuncturist is treating the root of the problem and not the symptoms only. Acupuncture for pain management. Everybody experiences some pain or discomfort during their lifetime. Acupuncture will help to improve acute and chronic pain problems. Acupuncture stimulates the brain to release chemicals, hormones, that act like natural opiates. Acupuncture can stimulate the brain to produce endorphin release. An endorphin is a natural pain relief substance which makes us feel good. So after treatment, you will feel more calm and relaxed. Cosmetic facelift effect. In recent decades, there is a lot of talk about the use of acupuncture for facial rejuvenation that acupuncture promotes. There are many ways to improve your appearance, and acupuncture is one of the safest and easiest ways to look 5 to 10 years younger. It is important to remember that in order to achieve these results, you will need at least 10 treatments and continuing care by your acupuncturist. Acupuncture and weight loss. It is clear that acupuncture will not make you lose weight, but it can help you on your path. Some of the main reasons why we are not able to stick to any diet are because it is hard to control cravings, keep calm, and change your lifestyle. This is where acupuncture starts to work. It is well known that acupuncture will help to control cravings, reduce appetite, and relieve stress. Emotional eaters will greatly benefit from this. As a result, lifestyle changes are going to be easier with less bumps in the road to wellness. Acupuncture to quit smoking. Many people don't know that acupuncture is a great tool to help you stay away from cigarettes. Needles will not make you quit, but they will help you stay on track. Acupuncture will help by lessening withdrawal symptoms. These symptoms are not limited to stress, anxiety, insomnia, restlessness, and emotional distress. Acupuncture is an option to make these symptoms easier and more controllable. Therefore, the first decision you make to quit smoking is to look for an acupuncturist who can start you on a road to wellness. Acupuncture alleviates migraines. Acupuncture has been proven to prevent migraines. The approach used to treat migraines is to remove the root cause of the migraine, and that is tension. Another benefit of acupuncture treatment to a migraine sufferer is that it is painless, and there are also no side effects of the procedure. Acupuncture reduces diabetes symptoms. If you are looking for ways to naturally control your diabetes symptoms, you may consider acupuncture as a viable form of treatment. Acupuncture is mostly painless, but sometimes a slight pricking sensation may be felt when needles are inserted. Continued research on the effects and benefits of acupuncture show that this modality can be an effective primary treatment in healthcare, as well as a useful adjunctive therapy. One of its appealing features is no side effects when performed by a licensed acupuncturist. Different styles of acupuncture. What you need to know. If you don't know much about acupuncture, it can be confusing to learn that there are different styles or schools, with different philosophies and ways of practicing. This article explains the main differences to help you choose what is right for you. Medical or traditional. The main differences between the modern, Western ways of working, so-called medical acupuncture, and the ancient Oriental styles, traditional acupuncture. These two are so different that to call them both by the name acupuncture is quite misleading. Medical acupuncture is a recent creation based entirely on the principles of Western scientific medicine. Training courses for qualified Western practitioners, such as GPs, nurses, physios, etc., are very short, typically around 5 days. This therapy is used almost exclusively for pain relief, although it may occasionally be used for other conditions. Sometimes physical therapists, such as chiropractors or physios, use this kind of acupuncture in their practice, in which case it is sometimes called dry needling. Traditional acupuncture is the ancient therapy developed in China and now widely practiced across Southeast Asia and the world. It is a holistic treatment based on a fundamentally different way of viewing health and disease. Training courses take around 3 years. It is probably traditional acupuncture that you think of when you think of acupuncture. It can be used in a wide range of physical, mental, and emotional conditions. Types of traditional acupuncture. The main type of traditional acupuncture practiced all over the world is TCM, traditional Chinese medicine. This is what is taught and practiced in China, and is the standard for most Western courses in traditional acupuncture. It has a history stretching back over 2,000 years, and given the name TCM in the 1950s, when a structured syllabus was first created for teaching across China. Until then, there were many regional variations. Other countries have developed slightly different styles of their own. For instance, Japanese acupuncture, which is known for its very gentle techniques and use of abdomen diagnosis, feeling the abdomen as a diagnostic tool. Korean acupuncture also has slightly different theories, and it tends to favor treating constitutional problems. Some Korean acupuncturists use only acupuncture points on the hands for their treatments. On the whole, though, Japanese and Korean acupuncture are quite similar to TCM. Auricular acupuncture uses acupuncture points on the ears to treat illness. It can be used alongside other styles, in which case body points will also be used, or on its own. A recent creation, the NADA protocol, uses 5 acupuncture points on the ear in the treatment of addiction. 5 Elements acupuncture was created in the 1950s by an Englishman, J.R. Worsley, who had trained in different countries in Asia. It focuses on treating constitutional imbalances and is said to specialize in the psychological and emotional conditions, though these can also be treated by other styles of traditional acupuncture. It is quite different in theory and practice to TCM. Finally, classical acupuncture is a new term for old medicine. It is a catch-all term that describes ancient ways of practicing that predate TCM, particularly incorporating Taoist ideas and techniques. Choosing an acupuncturist. It is important that you know the difference between medical and traditional acupuncture, but the differences between different traditional styles might well not concern you much. If you are looking for an acupuncturist, more important things to consider are the practitioner's training and experience. How long have they been in practice? And have they treated your condition before? Do they practice any other branches of Chinese medicine that could also be of use to you? Tuina massages, herbs, qigong, nutrition, and most importantly, do you get on with them and trust them? How acupuncture works, basics of acupuncture. You might be asking why the Chinese pierce needles in their skin. You might assume that those are things for a circus or a masochist to practice. Actually, the procedure is known as acupuncture. The poking of needles into the skin is a healing art, a medical treatment that really works. Acupuncture is associated with traditional Chinese medicine, TCM, for a fact that acupuncture has its roots in ancient China. How acupuncture works. Perforating fine filiform needles into certain points in the body is a technique used for acupuncture to alleviate pain or for therapeutic purposes. These points, according to TCM, are located where the qi or the life energy flows. Meridian is the term used for areas of energy flow. It is in the 12 main meridians where most acupuncture points exist, which match up to vital body organs such as the kidney, liver, and lungs. There are various ailments that can be treated through acupuncture. Popular in the West are the acupuncture for the treatment of pain conditions like arthritis and headache, as well as acupuncture for weight loss treatment. This ancient Chinese healing art was bombarded with numerous criticisms from scientists and Western doctors, arguing that there is no anatomical or histological basis for acupuncture points. But somehow studies demonstrate that acupuncture is effective for a number of conditions, despite being considered by some as quackery. In the 20th century, a rigorous scientific research was carried out, but still acupuncture was not well understood when it comes to its effectiveness. A balance between yin and yang in the body entails good health and TCM. These are opposing forces that work together in synergy. Yin and yang can be likened to dark and light, male and female, or high and low. Femininity is associated to yin, while masculinity is for yang. The free flow of blood and qi are the most important aspects of TCM in acupuncture. Since qi has no equivalent term in English, it is hardly translated, but more or less it can be considered as a form of life energy. In certain parts of the body, qi is sometimes excessive or deficient, and at times qi in the body has stagnation. Draining the excess of qi, promoting its free flow, and replenishing it if there is a deficiency are the objectives of acupuncture. To wrap it all, the healing art of acupuncture is remarkable. Its effectiveness in the treatment of various conditions can't be denied, even for scientists, regardless of being alleged by some as quackery. If you are suffering from a particular ailment, you can consider acupuncture for 100% natural and safe treatment. For centuries, acupuncture has been practiced for good reason. Most frequently used acupuncture supplies. Acupuncture is a Chinese medical therapy which involves the activation of key points in your body using meticulously inserted needles, and it requires various types of acupuncture equipment. With the growing demand for acupuncture treatments, these acupuncture supplies and equipments are readily provided to the market in order to ensure that your patient gets the most fulfilling acupuncture treatment available. Traditional Chinese medicine clinics have huge variations as far as the used acupuncture supplies are concerned. Sometimes contamination controls are performed in order to check the traditional Chinese medicine products in order to maintain an acupuncture medical clinic risk-free. Needles. The acupuncture needle is definitely the basic and most important acupuncture instrument. It has the ability to produce remarkable healing results. Understanding how acupuncture needles are manufactured, the various types of handles, metals used, and needle tips will allow you to select the right needle for the suitable application on the patient. Even though many acupuncture products do not permeate the skin like, for example, acupuncture needles, cleanliness is still a significant matter. Most expert acupuncturists use pre-sterilized needle packages, intended to be disposed after the treatment of each patient. Acupuncture needles are available in a number of sizes and diameters, depending on their intention and on which part of the body they are to be utilized. In ancient Chinese procedure, there have been as much as 9 kinds of needles. Needles are crafted from a number of metals, such as gold and silver, along with much less standard materials similar to stone or bone. In contemporary acupuncture, the most typical form of needle is the metal filiform, or thread-like needle made from stainless steel. Moxa sticks. Numerous practitioners of acupuncture also carry out moxibustion and have to source moxa products among their other acupuncture supplies. It is a type of heat treatment which stimulates acupuncture points on the body. For that reason, acupuncture supplies often comprise herbal products for moxibustion, moxa sticks or rolls, incense, and extinguishers for moxibustion. Typically, the moxa wool is compressed or rolled into a cigar shape, which makes it simple for the practitioner to steer the burning ember over the body. A very important variation of the common moxa stick consists of smokeless moxa, which is usually a carbonized blend of moxa and herbs. This makes it practically smokeless when burned. Sook moxa sticks are made from a mix of wormwood, sagebrush, and mugwort, which produce a nice aroma of burning wood. Cupping set. The cupping treatment therapy is an alternative treatment by which cups are positioned onto the skin to produce suction. The cups are made of various materials, which include earthenware, glass, and bamboo. Proponents of cupping therapy believe that the suction of the cups mobilizes blood circulation to enhance the recovering of a wide range of health concerns. Nowadays, there are a number of cupping sets available on the market, which integrate the usage of magnets and a vacuum pump, sometimes in combination with a hot flame. Acupuncture models and charts. Acupuncture models are often used by specialist acupuncturists. Most acupuncture supply shops store these auxiliary products. These acupuncture models are a particular replica of the human body, which indicates the acupuncture points on the meridians, which often serves as guides to find these points on a real patient. These models are generally made out of durable soft vinyl plastic material and mounted on a solid wood platform. The benefits of an acupuncture points chart. Acupuncture goes back a long way, and it is all centered on the basis of certain points within the body. You must know what these points are and where they are located for acupuncture to help you. If you need to know the placement of the acupuncture points, then you need a chart, and you need to know how to read it properly. An acupuncture chart is a great way for the new therapist to learn about the points and where they are located. And it's also good for someone who will be receiving acupuncture and just wants to know how it works. Acupuncture is an ancient form of medicine in which certain points of the body are used as treatment for other complications or pains within the body. There are literally hundreds of points on the body, located on various meridians from head to toe. It can be difficult to keep up with all of them, and an acupuncture's points chart can help you do this. You should never try to perform acupuncture on yourself when you are not qualified to do so. but many people just enjoy knowing where the certain points are and how they work so they can better understand their treatment. But there is more to learn from an acupuncturist point chart than just what the certain points are. You can also learn about where they are located on the body, as well as the command points, the influential points, the 4C points, and more. These are traditionally written in a letter-number combination abbreviation that once you become more familiar with reading and writing about the acupuncture chart, you will memorize what they stand for. In addition, this chart can also teach you locations, descriptions, functions, and also the clinical applications for the acupuncture points. You can learn about the kun, which are measurements used to find the points on a particular person's body. If you want to learn more about acupuncture points, how to find them for yourself, what they do, and more, you need an acupuncture points chart. Whether you are new to acupuncture, thinking of getting it yourself as a treatment, or just someone doing research and wanting to know more about it, you can benefit greatly from an acupuncture points chart. The history of healing with acupuncture. Acupuncture is a traditional Chinese medicine that dates back some 10,000 years. It is a technique used to stimulate trigger points in the body by the use of needles to help alleviate pain and treat various diseases. Documents show that the practice began during the Stone Age era, where sharp-edged stones and tools are used to puncture and treat abscesses. Then later, the technique evolved to using needles made from metals such as gold, silver, and bronze. The philosophy of acupuncture is rooted from the teachings of Taoism. It promotes the balance of yin and yang and acquiring harmony between the human body and its surroundings. The first book that was compiled with a system of diagnosis and treatment about acupuncture is the classic of internal medicine book of the Yellow Emperor, dating between 100 BC and the 1st AD. The text showed support of the Taoist philosophy and handed down traditional medicines over the centuries. It also established precise anatomical locations of the meridians, or the qi energy, or vital life force that flowed within the body. Originally, there were 365 pressure points that were corresponding to the days of the year. The book also describes the origin of various diseases and what acupoints should be used to treat them. Years later, acupuncture continued to develop and was slowly introduced to various parts of the world, including Europe and the United States. It became the standard treatment in China, along with the use of herbs, moxibustion, or the use of heat therapy, diet, and massages. Another significant milestone of acupuncture was during the Ming Dynasty, where they formed the new basis of the treatment. Ming ordered to cast a bronze statue marking all the 365 pressure points, which was used for cross-reference. They also published a book about the success of acupuncture and moxibustion technique, which was subsequently used by future dynasties. Aside from indicating the various pressure points, the book also contains precautions of the two techniques and what manipulation strategy is best used. Acupuncture was popularized extensively when Sun Simiao, a renowned physician from the Tang Dynasty, compiled another book for the clinical experience of acupuncture. He produced a chart of 3 views, a multicolored chart of all the channels throughout the body. It was then that acupuncture was extensively accepted by the masses, and its use was widely spread. And eventually the number of pressure points grew to 2,000 from 365. Medical exchanges of acupuncture. The spread and exchange of acupuncture started when China sent their physicians to various countries, including Korea, Japan, and the European countries. They held frequent seminars and lectures and shared a great number of books to promote all Chinese medicine. Between the 500 AD and 700 AD, China introduced acupuncture to Japan. They presented copies of books about acupuncture classics and importance of acupuncture points. Through this, the Japanese government passed a law in 702 AD to fully study acupuncture and use it as their source of medicine. The spread reached Korea in 1092, where the exchange of physicians and techniques was very rampant. The science behind acupuncture was also disseminated through other countries, such as India in the early 6th century. And it was only during the 16th century when Europe accepted the benefits of acupuncture. However, interest for acupuncture declined during the 17th century as it was believed to be an irrational medicine. This brought about the introduction of Western medicines, but the knowledge and practice remained in central China. The popularity of acupuncture began in the United States only in the 19th century when a writer from the New York Times produced an article on how acupuncture brought tremendous relief from his chronic pain. He was amazed how acupuncture gave him a more prolonged relief, far from the anesthesia and painkillers he was taking. Though acupuncture is not thought as superior to Western medicine, it is now widely accepted and believed to be effective. It is a holistic treatment that does not focus on the exact cause of any condition or illness. Rather, it patterns its treatment from the negative imbalances that the body endures, brought about by its psyche, lifestyle, external pathogens, environment, and stressors. It uses 12 meridian channels, which they believe is where our qi or energy flows, and by inserting needles, these channels are stimulated, and the body is brought back to its balance. Studies even show that acupuncture remedies can increase pain-relieving hormones, such as serotonin and endorphins that block pain sensation and inflammation. Acupuncture also proves to improve blood circulation and the immune system. Indeed, acupuncture is no longer an ancient practice, but a holistic treatment proven to treat a wide range of conditions and diseases. Top 3 types of acupuncture methods that help in back pain. Acupuncture is a traditional medical practice that originated in the Far East 2,000 years ago. Due to its proven healing ability, acupuncture is gaining recognition in the West. The medical industry is slowly acknowledging this traditional healing method, which is very popular in healing back pain. To be discussed below are 3 types of acupuncture methods that help in alleviating or healing back pain. Chinese traditional acupuncture. Chinese traditional acupuncture opened the door for acupuncture's introduction in the world stage. It is considered as the most popular type of acupuncture method. Acupuncture has been used and is still being used in China to cure a variety of different illnesses, one of which is back pain. Needles are used in this type of acupuncture, which aims to control or balance the flow of qi in our body. A balanced qi flow will help a patient ease his back pain. Japanese traditional acupuncture. This acupuncture method is similar to the Chinese method, but it uses needles which are thinner than the ones used in the latter. The usage of needles in this type makes the method more than that of the Chinese. This method also aims to control and balance the flow of qi in the body. Korean traditional acupuncture. Another type of acupuncture for healing back pain is the Korean traditional acupuncture. Compared to the first 2 methods, the Korean type of acupuncture is more recent, but it is as effective in healing back pain. In this method, the needles are inserted in the hands only, and not on different parts of the body, which is being done in the Chinese and Japanese types. The needles used are much smaller and thinner. Now that you know the most popular type of acupuncture methods that can be used to alleviate or ease back pain, please remember to consult your doctor first before trying out one of these methods. Your doctors could provide you medical information which can be used by acupuncture experts as guide in the healing treatment. Understanding acupuncture benefits and 3 phases of therapy. Staying healthy requires practices in prevention, self-awareness, and self-care. Knowing the underlying principles of care and the health benefits that traditional Chinese medicine and acupuncture can offer is one step closer to optimal health. The therapeutic benefits of acupuncture are often misunderstood. Following through on a proper course of acupuncture treatment could be the difference between finding relief and continuing to struggle with a chronic health condition. Good health is about good circulation, a common condition that is often treated successfully with traditional Chinese medicine, or TCM, is qi and blood stagnation. Qi is recognized in TCM as a form of bioelectricity that circulates with blood through the body. Pain is obstruction to qi and blood flow preventing the transportation of healing agents found in blood and qi to the affected area. Think about how the heart pumps blood through the entire body, and you will understand how easy it can be to develop qi and blood stagnation. Blood is pumped out of the heart into large blood vessels called arteries. Blood is propelled fairly easily through these arteries with considerable pressure as heart muscles contract. Arteries continue to narrow into very thin vessels called capillaries, then eventually spill the blood out into the narrow space between the body cells called interstitial space. Blood pressure at this point is weak. Body cells can extract nutrients from blood cells that are speeding by, so this is natural, but the potential for obstruction is great. Injury can damage and obstruct circulation, but simple muscle tension, poor posture, and artery clogging meals are some examples that can also impede circulation. Squeeze your hand and your knuckles turn white, blocking the flow of blood. If you tried to maintain a tight fist for too long, you would soon begin to feel numbness and tingling, and eventually pain, chi and blood stagnation. Chronic pain results when healing agents in the blood and chi cannot reach to repair the injured area. Acupuncture treatment can help promote circulation and restore the body's natural healing abilities. Acupuncture is a therapy, meaning it often requires multiple treatments to correct an imbalance and restore harmony and health. There are phases of treatment that are important to understand in order to properly apply acupuncture as an effective therapy for the relief of health issues such as chronic pain. 3 phases of acupuncture therapy. Relief therapy. Relief of symptomatic pain, imbalance, frequent treatments. Stabilization therapy. Stabilize relief therapy so symptoms don't return, frequency is less. Maintenance therapy. Maintain stabilization therapy. Frequent treatments are not necessary and only occasional. A new acupuncture patient will often ask how many treatments it will take to resolve their problem. There is no exact answer. Treatment plans are unique to each patient and their specific imbalances. Results and length of therapy will vary according to severity of condition and the health of the patient. For example, a chronic condition may need long-term care in comparison to an acute condition. A patient with a weak construction may need more therapy than a patient with a strong construction. Acupuncture needles are very thin, sterilized, and solid as opposed to hollow. No substances are injected into the patient during an acupuncture treatment. Such injections usually create dramatic changes that are not naturally produced by the body. For example, cortisone injections are often used in Western medicine for chronic pain. You can only receive a few shots per year because overuse can stop the body from producing its own cortisone naturally. Frequent acupuncture treatments are needed to awaken the body's own natural healing abilities and produce an accumulative and more beneficial effect. The therapeutic gains of treatment build momentum from one treatment to the next. In a condition such as chronic pain, circulation is blocked, preventing the healing agents found in blood to be delivered. Acupuncture therapy can improve circulation and over time relieve pain. A proper course of treatment that is generally accepted to be sufficient to produce a beneficial effect is about 10 to 12 treatment sessions. A patient stopping treatment after a couple of sessions has not given their body the chance to experience the accumulative benefits of acupuncture therapy. Relief therapy may require 2 to 3 treatments per week for several weeks to relieve a majority of the pain and restore function. Once benefits are experienced after relief therapy, it would be too soon to stop treatment. Oftentimes, healing is not complete, and to prevent the reoccurring pain, stabilization therapy is necessary. Frequency of treatment may be 1 time per week, or 1 treatment every other week. After observing stability in the condition through treatment, then a patient progresses into maintenance care, which could be 1 treatment every month or every few months. Acupuncture therapy is focused on promoting and maintaining health as opposed to the necessary but distinguishing care of Western medicine, which mostly focuses on trauma. An internship for a medical doctor is often done in an emergency room, a trauma-focused environment. Maintenance therapy is something that is encouraged under the scope of acupuncture and TCM. It only makes sense to be engaged in prevention to promote optimal health through such therapies as acupuncture, herbal medicine, diet therapy, healthy lifestyles, and exercise like Tai Chi, Qigong, and meditation. Knowing how to take care of yourself is power through wisdom. Teaching self-care is a fundamental part of acupuncture as a natural and holistic therapy for the mind, body, and spirit. Prevention starts with awareness of yourself and your personal imbalances, and then taking steps to restore and maintain optimal health.